Welcome to session number 6 in the Painless Childbirth course. Great to be with you. Today is going to be a different day. Welcome to my new office, by the way. Not really. This is my car, and the reason that I'm in my car is because what we had said the last time. Remember, we said that we're going to go visit different professionals that help women have a better birth through different means. Today we're going to be visiting Mia Glick, and Mia specializes in prenatal yoga, and you can get a perspective of what yoga is. If you've ever wondered to do yoga, they have special prenatal classes to help strengthen the body and the mind in order to have a better birth. And the second person that we're going to see today is Erica Booman. Erica is an excellent professional in what she does. She does personal training, and she specializes in just training pregnant women, and the reason for that is to strengthen the muscles that aid in giving birth. Of course, stronger muscles are going to help you have a better birth. You're going to be stronger for the birth itself, and you're going to be able to push the baby out quicker. Well, of course, we'll get Erica's perspective on that, but now let's go ahead and head out to the professionals' places. I'm starting up my car, and we're ready to roll. We're sitting here with Mia Glick, and she is a certified, is that correct, certified?
Yes.
Certified prenatal yoga instructor. I know she's been doing it for a long time. She has a beautiful center in Browns on Lincoln Road in Miami Beach, and it's a yoga center at Browns. And Mia, how long have you been doing prenatal yoga?
I started prenatal yoga when I was pregnant with my daughter about 10.5 years ago.
And that's when you started teaching it, or is that when you started taking it?
I started taking it when I was 16 years old. I started practicing yoga, and I started teaching yoga about 15 years ago, and then started the prenatal about 10.5.
So you have a lot of experience in yoga.
Yes, I do.
My first impression of yoga when I heard about it was a meditating yogi somewhere on the side of a mountain, becoming one with the universe. And I know that that's not true. A lot of people in America and throughout the world do yoga, and it's very prominent. There's a lot of videos about yoga. There's a lot on the internet about yoga, and you can learn practically something new every day. So if you were going to explain to me, a newcomer or somebody that's watching the video, what is yoga all about, what would you say? I know that there's a long version and a short version.
Yes. That's a very good question, and it's one that I am constantly recreating and discovering in my own practice. But to put it simply, it's about balance. You know, it can be a physical practice only. It can be a practice of the breath, and it can be a meditative practice, which is the mind. So you can blend them. I think in America it's mostly a physical practice, but we're evolving. My practice in the beginning for the first 10 years was just a physical practice, you know, so I wasn't really ready for the more mental meditative practices yet. So, you know, I think in time it evolves from more of a physical to a mental meditative practice.
Okay. So basically what you're telling me is that yoga can speak to a lot of people. In other words, a lot of people can be involved in yoga. How does yoga specifically talk to the pregnant woman, to, you know, prenatal?
Because we're working the body, and we're learning about the breath, and there's some meditative qualities to it. I think it helps a woman who's pregnant to really center, because there's constant shifting in her body and in her mind because of the hormones. That in yoga it teaches a woman to find the changeless in something that seems like it's always changing. So to find that place that never changes, that still point, the center in their physical body. So we practice balancing postures, and also the centering of their mental body, where their mind can be trained to have moments of stillness.
So this is fascinating, because from what it sounds like to me, it sounds like when as a woman's body constantly changes throughout pregnancy, she can still find balance, and that's helped with yoga.
Absolutely.
Okay.
I love seeing my women in my classes that are, you know, 37 weeks pregnant, and they're standing on one leg, you know, with their arms, you know, in different positions over their head, or, you know, and it's just gorgeous. and they're not moving, you know, they're not completely still like statues, but there's this incredible sense of who they are and where they come from and where they're going. You know, this incredible sense of balance, you know. It's beautiful.
Okay, so my next question is, you said something about 37 weeks. When should a woman start taking prenatal yoga?
Well, it's funny because just yesterday I had a woman come for the very first time who was 37 weeks to my class. So she's just a perfect example of anytime. I mean, come, you know, to class even if, you know, you're due, you know, that same day. You know, come whenever you're ready. There's really no strict rule unless there's a medical issue. You know, ask your doctor, consult with your, you know, healthcare professional, and check it out with him or her first, and then it's really up to you.
That's excellent, and absolutely. Whenever you're going to do anything that's exercise related, of course you have to check with your medical care provider. Are there any contraindications to yoga? Are there any women that can absolutely not do yoga because of a medical condition?
Well, that's probably a question better for a doctor.
But with your experience that you know that you've seen, maybe.
Well, prevent where the placenta, you know, is instead of being up top is down. If they've had weak cervix, you know. Those are the only ones I can really think of right now. Maybe high blood pressure.
Okay.
But I think, actually, no, I take that back. The high blood pressure thing is okay. They just have to tell the teacher beforehand, so the teacher knows, you know. But yeah, that's it.
So, and again, I want to reiterate that if you have any condition that you may suspect, that if you do anything physical more than what you usually do, please consult with your healthcare provider. I know that there are different styles of yoga. I've heard about it, and obviously you can educate us a lot more. What style is used for a pregnant woman? What style is used in prenatal yoga?
There can be different styles, but in my class I blend a few different styles. I blend Kundalini yoga with like a more Anusara Iyengar style. So for those watching who know yoga, that's the style I teach. The first part of my class combines movement, breath with mantra. And it's really good because it works the lymph system, because anytime you breathe and move rhythmically, it moves lymph through the body, out of the body.
Okay.
And it's more meditative, and it teaches the breath. And then we move into a more Hatha style class where it's about the postures and strengthening the body and gaining flexibility.
So when a woman goes to her birth and she's going to have her baby, what from yoga does she bring with her?
Well, I had one student, she actually gave birth in Belgium. But while she was here, for most of her pregnancy, she was here in Miami Beach. And she came consistently to my class. And she left and went to Belgium and had a baby. And when she came back after her baby, she came to my postnatal class and she said, "Mia, I have to tell you that during my labor, I did your whole class." Because typically I have the same series of postures I do from the beginning to the end. And every class has that same sort of flow to it. So she did the flow while she was giving birth. Obviously not the standing postures, but the first part of class I was talking about where there was movement, breath, and mantra as one.
Okay.
Yeah.
Beautiful.
Yes.
So if somebody wanted to get in contact with you, somebody that's local, what would they call? Where would they go? What's your contact information?
They can go to my website, which is yogawithmia.com, and they can email me through there. It has all my contact information there. But I'd like to say one more thing, and some babies are born through the window and not the door. And so for women who are having planned cesareans or they're, you know, giving birth by cesarean, they can still use these yoga techniques as well.
Oh, it's very good to know.
The breathing, the mental focus, the staying conscious, and they can have a conscious birth with other ways as well. So I just think it's really important to embrace all styles of birth, of giving birth, so that there's more acceptance afterwards as well.
That's very, very good to know. So for those women that are having a hospital birth or having a birth with a midwife, if they're going to have a cesarean section, they can still use yoga as a tool, not only physically but also mentally.
Yes, their breath, staying connected to their body, to their baby, to their breath, to their mind. Are they in their negative mind? Are they fearful? And just being able to have the tools, maybe a mantra to breathe with that can carry them through the birthing process. Yeah.
All right.
Hi. Hi, Louie.
Beautiful.
Hi.
Well, I'd like to thank you very much for being with us today and for sharing your information and your knowledge. And I know that a lot of people have learned many, many good things. And thank you very much.
Thank you.
I'm sitting here with Flavia, and Flavia is one of Mia's students, and I want her to tell us a little bit more about her experience with yoga so that we can understand a little bit more how it works and how it's been helping her. Flavia, thank you for joining me today.
Nice to be here. I hope we can help other people and just talk about the benefits of doing yoga. It helped me a lot, and I hope it's going to help other women.
Absolutely. You are how far along in your pregnancy?
I'm 18 weeks and I'm pregnant with twins. It's my first pregnancy.
Wow.
And it was overwhelming. I came and signed up for Mia's class for yoga, and it just felt so great. It just helped me balance, made my body stronger, my mind stronger. And I think it relieved a lot of the anxiety that I felt at the beginning. And I'm very grateful.
Let me ask you this then. Did you have a lot of fear at the beginning when you found out that you were pregnant? The typical fears that women usually have. And then has that changed as you've been doing yoga?
I did. So I had a lot of fear and anxiety. Doing yoga helped me overcome it. Every time I go to my yoga classes, I feel that I'm leaving a better person. I'm not afraid. Now I'm not afraid that my babies are going to be premature. I'm pretty sure that having a strong body and a strong mind will help me carry them to term. And then having healthy babies and a healthy delivery will be wonderful.
Beautiful. Thank you so much for sharing your story with me. Wasn't that great?
Thank you.
It's really nice to sit with professionals that know what they're talking about and can help you have a better birth. Let's go to Erica Boom now, which is a personal trainer, and let's hear what she has to say. I'm sure she has a lot of good things to teach us. I'm joined by Erica Boom, and we're here at a beautiful center here in Southwest 8th Street in Miami, and this is Belly and Kicks. You can obviously see around you the exercise equipment, and Erica's been doing this for a long time, and she's a professional at what she does, and she trains women specifically to have a better birth. Erica, thank you for joining me today.
No, thank you for having me here.
How long have you been doing this?
About 7 years already.
Okay, and here at Belly and Kicks, what happens on a typical day? Pregnant women come in. Do you only work with pregnant women?
Yes, I only work with pregnant women one-on-one. In a typical week, let's put it that way, a girl comes in twice a week, in average. Every time they come in here, they spend 40 minutes with me. I do a full body workout with all the machines that you see here, all the free weights. We do a lot of stretching and a lot of prenatal specific work.
When you say prenatal specific work, what does that entail? What do you mean by that?
I focus a lot on the core and the lower back. They need a strong lower back to support the growing belly. 2, I familiarize them with the transverse muscle, which is like the muscle that's basically gonna hold the belly and it's gonna push the baby out during the pushing phase of labor. And I help them to familiarize with the pelvic muscle as well, the pelvic floor, and getting familiar with all those three muscles.
Now, a question just came up to mind. I know that because of the hormones, there's a lot of shifting of bone in the spinal cord. Do you know if the exercises that you do helps for that?
The exercise, I do focus a lot on the belly of the muscle, which, you know, you're gonna get it stronger, and ideally it's gonna release some of the stress that the bones suffer throughout pregnancy.
Okay.
So the idea is that if the bone stretches or the alignment fails somehow, you have a strong muscle to continue like carrying you throughout the rest of the pregnancy.
So throughout the years that you're doing this, do you hear of less backaches because women are doing personal training?
Oh yeah. They come in here with terrible back pain, weak back, stretch abdominal muscles. I put them here on the program. We emphasize a lot their lower back, and the back pain is gone by a couple of weeks.
That's beautiful. That's great to hear. So if you have any lower back pains, go to a personal trainer, obviously somebody that's certified. Do you have to be certified? Do you take a special class just to work with pregnant women?
Yes, you should.
Okay.
There's a lot of contraindications to exercising during pregnancy, and the trainer should be very familiar with that.
Okay, so and if I can ask you, and of course, I will mention again, just like I mentioned with Mia and yoga, any type of medical advice or anything that sounds like medical advice is not to be taken as medical advice on this video. Please go to your healthcare practitioner. Erica, what type of contraindications are we talking about?
First of all, there's certain moves that should be prevented, like anything that you're lying on your belly or actually lying on your back after the first trimester should be avoided. That would be one thing. The other one would be maybe deep squatting or deep lunging if you have like an incompetent cervix or if you're carrying multiples. Doctors sometimes don't want you to be deep squatting because of that. Three would be you want to always emphasize that they breathe through the stickiest part of the movement, so don't hold their breath, because that will bring your blood pressure up, and it's not good when you're pregnant.
Okay.
So you have to look a lot at the face of your client and remind them, breathe, remember to breathe and keep breathing. They need to hydrate properly. And just overall, there's certain exercises that become uncomfortable with the growing belly, so you accommodate them.
So you basically customize. Do you have to customize for each individual woman? It's not just a set workout.
Yes, each person's different. You know, for one girl, you know, has a pain in their pelvic bone, the other one in the back. Their round ligaments are hurting. Their breast doesn't let them like push down, you know, deep enough. So each person's different.
So then the woman has to be very well aware to tell, and the personal trainer has to be very well aware of what's going on with her, or we can call her client or patient almost, and she has to be well aware of what to tell the woman that she's working with or the person that she's working with, otherwise there could be serious injury.
Exactly.
So that leads me to my next question. When should a woman begin personal training? Before her pregnancy, during her pregnancy? When's the best time to begin?
Ideally before pregnancy. That way your body got used to the stress of exercise. You arrive into pregnancy in a fitter state, but that's not the case for a majority of women.
I would imagine.
So I would say if you've been already working out, you can continue. You know, you can start right away. A lot of the women are conservative if it's their first kid during the first trimester, and they like to take it easy sort of to see how things develop, and then they pick it up around 13, 14 weeks. And then for second-time moms, they already have a history, they know how everything goes. So I have a lot of second-time moms coming in like by the 5th, 6th week, because they already know.
Now let's say a woman never exercised before, and she would like to get pregnant. She's thinking of getting pregnant. How many months before she actually says, okay, I'm going to try with my husband now to start getting pregnant? How long before do you think is good to start something like this?
To start working out?
Yes.
At least 3 months. 3 months is more or less the period the body takes to adapt to any exercise program. So that way, by the end of the, at least 3 months, I would say.
Okay. And my next question, what if a woman is already later on in her pregnancy? When should a woman absolutely not come and do personal training?
Okay. The latest I receive people in the studio is 32 weeks. No later than that. If they come 34, I tell them come after you have the baby. It's already like too soon, you know, for your due date. So
what could potentially happen for a woman that says, either with a personal trainer or just says, well, I just want to start working out by herself? What could potentially happen to her?
At this point, all your ligaments are stretched out, the muscles are weak enough, you can injure yourself, you can add additional stress to your body that you don't need at that point, basically.
Okay. Yeah, so, you know, please always keep in mind, if you're later on in your pregnancy, if you're in the second or third trimester, if you've been listening obviously to Erica, what she has said, if it's too late in your pregnancy, please do not start working out. Erica, is there anything else that you'd like to tell women out there as far as personal training or pregnancy is concerned?
I would encourage every pregnant woman to exercise while they're pregnant. It's gonna make a difference in the way they feel, in the way they look. It's gonna help you with your energy levels. It's gonna help you to feel better, and it's gonna help you to cope with all the discomforts, the physical and emotional discomforts that pregnancy brings.
That's beautiful. Thank you very much, Erica, for being with me today.
You're welcome.
And it's been wonderful. Thank you.
You're welcome.
Wow. It's amazing how something so beneficial can be equally as dangerous. Please be careful. Well, that's it for session number 6. Next session, we're going to continue with other professionals that will help you have a better birth and have a better pregnancy. Until then, have a great week and take care of yourself.